Hi, I'm Andrew Barr. I'm a founding partner of Gray Matter Capital. We are a venture capital firm focused on mental health, behavioral health, brain health, all these things. And today's panel is actually something that is like completely out of my zone of expertise. But luckily, we have an amazing panel here to talk about federal funding for your mental health startup or other mental health organization. And really, I mean, a pretty incredible group of panelists. I'll let them introduce themselves. But what we're going to talk about today at a high level is how you can go about getting funding that is not venture capital funding, the alternative here, which I think is non-dilutive funding or other kind of grant funding for various things you might be doing. What we're going to try to cover here, and we'll have a pretty strong section for Q&A at the end, and hopefully we can keep it conversational and you can learn what you're trying to learn or get out of this. But we'll start by talking about really, who should be thinking about this type of funding, and what are some of the high-level advice for who should be applying, how should you be applying, what are some of the pitfalls, et cetera, in the kind of more the more general sense. And then we'll get into some case studies and examples from these panelists, and then we'll open it up for Q&A and go from there. So maybe if we just start with you, Cara.
Always helps when you turn it on. I hope some of you got the Bueller joke there. Thanks, appreciate that. Cara McNulty, I'm CEO of Vibrant Emotional Health. Vibrant is and has been in existence for 55 years. We provide the back-end administration for the 988 Lifeline, as well as numerous other lifelines, whether it's for the NFL, New York City public school children and teachers, whether it's for veterans. And we do a whole host of services within New York and beyond. I am a population health scientist by background. I make corny jokes. And I have been on the payer, the provider, the federal, the state, the community, and now the nonprofit side of the behavioral health equation. So it's great to be here.
Great to have you.
I'm Jennifer Huberty. I am the CEO, founder of Fit Minded. I work as a fractional chief science officer. It's a small science consulting company. I spent 20 years in academics as a research professor and left for industry, spent 5 years at COM as the director of science, and have received over $10 million in funding from the government, both as a researcher, but also for companies and businesses.
I'm Katie Rudek. I am the VP of Clinical Integration at Soluna by Kooth. We are a preventative mental health app for young people, serving ages 13 to 25, providing that upstream approach to mental health care. My background is I'm a mental health professional. I spent 10 years providing clinical mental health services to young people in the state of Minnesota. So very excited to be here today.
I'm Mike Milham. I'm the Chief Science Officer at the Child Mind Institute. The Child Mind Institute is an independent nonprofit specifically focused on child and adolescent mental health and learning. My background is a combination of brain imaging researcher as well as child and adolescent psychiatrist. In recent years, I've also had a growing focus on digital therapeutics and varying digital solutions, trying to really integrate insights from science and bring them towards something that could be more of service to the community in a more immediate future. And I would say from the NIH end, that's something that I've had a painful amount of experience in as an NIH investigator. So I know the ins and outs of it and can hopefully be of help.
Well, thank you all so much for being here. Maybe we'll start and we'll go down the line is really, who, for this audience, who should be thinking about applying for federal funding and how should they be thinking about it? And what should they be doing at a high level to prepare to do that successfully?
So at Vibrant Emotional Health, we have the back-end functionality of 988. So our largest funder and partner is SAMHSA. And when I think about having been on all these sides of behavioral health and mental well-being, I mean, most people don't go through the system and say, that was the best experience I've ever had when I was seeking care. And so when I think about how do we really change and evolve a behavioral health, mental health ecosystem, it's in partnership. So we partner with SAMHSA. We are partners with community crisis centers, 213 across the United States. We are partners with state entities. So I would think about it from the lens of, what are you trying to solve? Why are you trying to solve it? And then who are the partners that you can consider working with? We are one partner of SAMHSA. We are not the only partner. We are a partner that we work collaboratively with SAMHSA and state agencies and crisis centers. But I would say, what are you solving for, and who do you partner with? Because we're not going to do this work or achieve outcomes without that partnership. And if one entity could do it really well, they would have already done it.
So I've talked to maybe 200 companies in the last 2 years about science, and many of them want to write grants. These are like pre-series, Series A. And their question is, can you write a grant for me? And my short answer is no. But I don't really mean that. But what I mean by that is that it's really the question you have to answer is like, do I have any data? Do I have some momentum? Some. You don't have to have tons of momentum, but some momentum, just at least to proof of concept that we're going somewhere, we're collecting some data. If you have some data, then you've got to think about the strategy that you want to have, because oftentimes the first thought is, I'll get an RCT, I'll write for an RCT, and it's like, that's not necessarily what you want to be doing, right? So it's, do you have some data, and then stepping back and then saying, okay, with what we have and where we want to go, how do we set up a strategy? And the grant is written around getting to the end, right? So where am I trying to head? What little data do I have? If you have some momentum, then you should be ready.
Yeah, I can speak a little bit less to who should be applying for this type of funding. I completely agree that you really need to have your data in a row and know what are the things you're going to be contributing to the recipients of the service that the grant is intended to serve. But I can speak a little bit to, how can this affect the larger scale system? So the ability to receive this type of large scale funding can really open up access to a huge amount of people that may not be able to receive the care otherwise. Yeah, so that's all I have to say about that.
I think one of the key things really is thinking about why you're applying. And really, anytime you're thinking NIH, the first thing you should really do is reach out to program and figure out if you're a fit for what mechanism. You should be thinking about which, with mechanisms, is it something on the research side, at which point you're thinking about R01s and so forth, where that's really going to be led by an investigator in an academic institution or something of the ilk, nonprofits and so forth. Or is it really that you're meant to be going through the business route at the small business and STTR grants? And with the small business grants, obviously then the question is, do you have what it takes in your company on itself? Are you ready to go and compete in that space? Or is it STTR where your company can pair with an academic institution or a nonprofit and basically there try to leverage the strengths of both sides and go through that process together? And you need to prepare for the amount of partnership that has to happen in that process. Otherwise, what happens is it is a competitive space. People sometimes talk about how easy small business grants and so forth is. That is not so true. And it's also become very competitive now because you have so many investigators that are leaving the academic side and finding their way into the small business front. And that's going to make it much more competitive because those are investigators who've been writing grants for years and know how to do it very well. And so you really want to make sure you position yourself. But it all starts with program. If you go to NIH program and they advise you against it or tell you to change something one way or the other, you should generally listen.
That's great advice. Maybe we can start, I think that maybe taking a slightly different direction to start, let's talk about like a failure story. Let's talk about something you've seen, not necessarily in your own organization, but somebody who's kind of where it hasn't worked or it's been the wrong fit or something that, essentially a pitfall that people can avoid here in the audience. You want to start us off?
Sure, gosh, I have plenty of failures. When you think about Vibrant Emotional Health, we're a nonprofit. So often as a nonprofit, you're looking at funding opportunities and you're like, we kind of fit into that. Or maybe we could do that because you have to be scrappy. And when that happens, when you're trying to fit yourself into the funder's ecosystem, but you kind of can do it, take that gut check. Because it likely changes the trajectory of where you're trying to take your company, your nonprofit, your for-profit, I spent a lot of time at CVS and Aetna leading behavioral health, and one thing I learned over and over is the best thing we could do, and I agree with the programs office example, is to say no to people. So when we had early start or young companies coming, not to drag them out, not to give them hope like, oh, maybe in a month from now. If we weren't going to use or didn't have value in that company, we didn't see it, the best thing we could do was to give a solid no. It's just not for us. The same thing with grant funding or cooperative agreements. If it's not a good fit, like wholesale or 90%, don't do it. Because your why behind you're doing it is not going to be aligned with all the work you have to do to be successful. And so why is it that you're right for that grant or that cooperative agreement? And is it a grant? Is it a cooperative agreement? Is it, so are you doing this in collaboration or are you carrying out specific funding outcomes? So really, are you the fit? And sometimes we want to say yes to things because we need the funds, but it's better to say no.
So I've sat on many review panels for SBIR, STTR grants. I still do at the National Institutes of Health. And I would say what I see in review of what we'll call failures, I don't really like to use that word because nothing's really a failure just because an NIH reviewer doesn't like your idea. It doesn't mean it's a bad idea, let's be honest. But I think the first thing that fails is innovation, right? So you've got a company, you're reducing anxiety. Okay, well, so do the last 10 companies that submitted a grant. So what about you makes you innovative? What are you doing differently than everyone else? What's going to next level you? And how is that going to help because NIH really cares about commercialization. So the funds don't go for commercialization, but they care about commercialization. In the first phase grants, you have to write like a little paragraph on commercialization. In some of the phase 1, 2, or fast tracks, you have to write pages of commercialization. So that's it. So innovation, commercialization. I would say you do have to have the right partners. If you don't have the right partners, that could hurt you as well. And in the competitive spirit of things right now, you probably should have a scientist, researcher of some sort involved in what you're doing, because then they know you're serious about outcomes, those kinds of things. In companies, you're always going to see and I've submitted grants where it's like you list the people that are on the grant, and NIH requires it's a bio sketch, and you list all your expertise on that. And so it's like the person has one thing. It's like in academics, obviously, right, it's pages long and they cut you off, but they got one thing. This person has one thing. So that's great. They're product engineers. Okay, they're only going to have one thing. They're not. But then you have that scientist who it's like, okay, you got someone with the the CV, and then you've got all these business people. So the failures or whatever is innovation, ability to commercialize and show that either a paragraph or depending on the phase that you're in, and then, appropriate partners to strengthen your proposal.
Yeah, so does this align with our mission, vision, and values as an organization? And do we have the resources, do we have the bandwidth to pull it off if we do win the funding, right? I think you asked about like disaster stories, right? I've seen situations where like you receive this grant funding and then you go to your team, in my years in the nonprofit world, go to the team and say, okay, we got this, we're gonna provide this amount of peer support group in this many school districts across the state. And then everyone says, well, I have a full caseload. No. And so you can't even do it. So really not just looking at does it align with our mission, but do we have the bandwidth to utilize it if we get it?
Yeah, and I always get nervous when I hear the word fail when it comes to grants because, one could look at my numbers and say, oh, he's gotten a lot of grants. Look at the percentage. It's like, ouch. But that is how grants are. The thing is, you don't want to be the predictable failure. You don't want to be because anyone could look at and say you didn't have the right investigators that you're attached to try to validate what you're doing. You didn't have the knowledge of how to write an NIH grant. You didn't sit there and find a company or the right partners to sit there and help you write the commercialization plan knowing what's needed. If you, for all good purposes, have made the best foot forward, then you should absolutely submit because one thing I also see, sometimes people worry too much about submitting and what if it doesn't get funded. It's like your first round, you're not getting funded. It's rare. In SBR land and CTRs, it was less rare, but now it's becoming more of that. But you should be okay about it as long as you know you're putting a best foot forward and you use the review process to learn. Now, if you're going 2-3 times and you're not learning, then that's a different story. But I would often encourage people to kind of balance the hesitations about submitting with moving forward. And the thing is, you should never submit something that's embarrassing, that you know is going to be embarrassing or incomplete. But with that said, you sometimes have to take that first try. But as I said earlier, I would also make sure you run it by program. They can look at your AIMS page. They can tell you right off the bat, is that AIMS page going to sell or not? And you can use these kinds of approaches to help you feel, am I prepared or not?
Just one thing to add to that. My very first NIH grant was like $800,000. This was years ago. I was doing a PTSD intervention for moms who had had stillbirth using an online yoga, like a business. And my first time in, I got a pretty crummy score or non-discuss. I can't remember. But my advice was given, like, call the program officer, find out what they didn't like, blah, blah, blah. I got on the phone, and basically the guy was like, don't resubmit this. And so I was like, all right. So I hung up the phone, and I sobbed. And then I was like, screw that. I'm submitting this thing again. And I got it. I got, like, such a good score, it automatically got funded. And it wasn't 3-5 years. It was, like, a year or something like that. So it's like, tread that. That's why, like what you were saying, like failure is not a good word. If you're passionate about your idea and you know your idea, I mean, obviously we can go a little crazy with our ideas, but you've done your check-ins and your due diligence. It's like you get 3 reviewers and then a room full of people who don't even read the abstract, the AIMS page. And I'm a reviewer. I'm like, okay, these 3 reviewers have reviewed it. I'm trusting them because I can't read 25 applications in a review. So if you're doing your due diligence, and you got to keep going.
Fantastic. So I will say, please submit questions via that. We'll do a few more stories here, but we'll eventually open it up for Q&A, and there's a QR code here, I believe. If somebody could open questions so people can add their questions and we start to build the queue, that'd be great. Fantastic. Okay. Well, maybe we can talk a little bit about kind of success stories, right? And sort of what was an example that you could think of where there was federal funding that was highly catalytic for either organization you were working with or another organization, and maybe talk through a little bit of like what the goal was, how it came to be, what sort of made that such a success. Maybe you want to start us off again?
Sure. I'm just going to say there are plenty of seats right here, and you don't.
Yeah, come on.
And
come on
it
down,
takes
come on
courage, folks. Yeah.
Please, come on in.
There's plenty of seats.
It's like Southwest Airlines.
Yeah. Just come in.
Yeah, that's nice. If you have an open seat next to you, raise your hand so that
Yeah.
they know. That's
Yeah.
great. Thank you. Yeah, look at all those seats.
Look at them all. I've been that person sitting on my knees and it hurts. I wasn't at Vibrant when Vibrant decided to apply for a cooperative agreement with 988 SAMHSA, for 988 with SAMHSA. What I can tell you is the amount of collaboration, self-discovery, checking assumptions that it took in developing that application, and then getting that award, and then feeling forward, because some things didn't work, and a lot of things did, is monumental, and that is for that team that came before me. And probably the biggest learning that I've had, and I've been in this seat 4 months, is that it is constant course correction. So it's a partnership with SAMHSA, but it's not just waiting for SAMHSA to say, hey, we need you to do X, Y, and Z. It's what's the data telling us? What can we do about it? How do we share this in an effective manner so that you can continue to grow and improve? Because if we don't do that, then we get stuck with, well, it was a good try. And there's too many people that need us as a community to be really incredible in the behavioral health, mental well-being ecosystem. So I would say the partnership and how are we owning our mistakes, how are we owning our course corrections, and doing better because we've learned is so important. And SAMHSA has given us the grace and the space to do that. And there's also a ton of pressure. Our head of technology is in this room, and I'm sure he probably didn't feel grace and space always as 988 was about to launch.
So for success, I'll give an example of one of my clients who's just had their second, we just resubmitted. So we submitted and then we resubmitted. So it has taken us, I'd say, 1.5 years before we even started to write the grant. And that's the most important take-home message, is that they weren't ready. Like, I could have gone in when we started working together and I said, I could have written a gazillion grants. All I got to do is ask some cool research questions for what they were doing. But it was like, no, we need to figure out where, like, these are the goals of the company. We're collecting data. We're trying to get the information we need to inform the business, to get them to their goals. And as this is happening, we're learning things about, okay, this is working. This is working. This isn't working. Ooh, we should do this with the product. Ooh, we should do this with the content. Oh, let's go ask these people. Oh, let's add this piece. Okay, so now they're cruising. And now we're ready. We had strategy from day one, but we're letting the data inform us while we're keeping our business objectives, like where are we trying to go? Because at the end of the day, we got to make money, right? And so, okay, now we're ready. Now this makes sense for a proposal. And so we submitted, and then we resubmitted. So we're waiting on scores. But I'll just say that it could be 2 more years before they get funded. They might get funded this next round. When I was at COM, I received $2.5 million for a grant. It took me 5 years to get that grant, and I was working on that grant before I was even director of science at COM, just as a research investigator interested in meditation. 5 years. But then there was another grant I wrote at COM, and it took us 2 tries, 3 tries, so it's about 1.5 years in SPIR. So again, If you have a strategy and you know where you're going and you know where you're headed and you're answering the questions that are getting you to your business objectives, you will have the perfect grant application. And then you just keep fine-tuning it till you get those 3 reviewers that at least 1 and 2 love it. If 3 doesn't really like it, you'll get a high enough score.
Yeah, another thing is telling the real life story about how that grant funding is going to impact human beings, right? If you can kind of pull on the heartstrings of the reviewers and get them to really feel like their money or the money that they have power over to give you access to is going to make a real difference, that alongside, of course, data and a solid strategy is going to make a real difference. So especially if you're in a second year of a grant or you're writing a grant for an ongoing program, being able to pull those real life stories into it is very powerful.
Well, so I guess as far as a success story, there's one that I'll give the example of an STTR. So basically a partnership between a company and a nonprofit or academic institution. So there we partnered with My Resource, which I'm not just saying this because the business part of the partnership is in the room, but there it was something very successful. It was where we had met and realized like-minded objectives between the academic side and the business side, and really then looked at the resources that we both had. And on the business side, it was a platform for helping folks to find resources, focused on university populations. And on our side was the abilities with machine learning and different approaches to be able to help think through how do you optimize identification level of care and so forth. And then we went through, I think it's fair to say, like 6 to 9 months of working here and thinking it through. And at the end of a year, we were able to submit. And the first round, that went well. That one we got. The second one we submitted, we just missed the first round. But you usually don't get that lucky. Now we have the third. We'll see. But the thing is, part of it is because all the work that both sides had independently done before meeting and the capabilities, and then comes all the work spent together in working it through. And then once you get it, it's still a journey together because you have to work out IP and different things that are not required beforehand, and you have to go through the different nuances and learning to work together between a profit and nonprofit. It's a process, but it could be very successful and meaningful.
Fantastic. So it seems like questions have opened up, and we've got a few here. And so maybe we can start with these, and then if other people, if for whatever reason you can't submit through the app, please feel free to just stand at the microphone. So maybe you're getting a little bit technical here. Maybe somebody can clarify for the audience the difference between a research grant, an innovation grant, and a service grant / contract. Go ahead.
I mean, I can speak to federal research grants, and Adam wasn't able to join us, which was a bummer. He's obviously with the National Institutes of Health, but from what I've learned over the years, so there's different levels of research grants. So you can do SBIR or STTR, which those are for businesses. The SBIR is paired with a university. The STTR, I don't believe you have to be, but you probably should pair with a researcher, again, to lift your application up and be competitive. And then there's the R mechanism. So like an R21 is a pilot, and R34 is feasibility. Feasibility is similar to like UX, like those kinds of things. So that's a good one maybe for some of you. It could be an answer. And then the R01, you got to have data for an R01. You can't go in without any data. So you've got to have some serious momentum and published data, I should say, not just data, published data. So those are the federal at NIH. And you probably could talk about maybe more of this.
Sure. So you can, federal or state, you can have a cooperative agreement, which is where you're working in collaboration with the funding entity, and you have a North Star and outcomes, but the how you get there is a collaborative process. A grant is where there is a specific assigned deliverable, outcome measures, and a process that you're being funded to take.
Maybe kind of picking up on this thread, can we talk a little bit about the timeline of grant review and sort of maybe speaking a little bit to the relationship between how you match, grant review timelines and business timelines, how you deal with a couple of questions in this vein, how you deal with the uncertainty of, building a grant-reliant organization, or at least one that partially relies on grants.
I would say you should be conservative, because even your optimistic scenarios, you should always plan about 2 years. I would be my thing as far as I'm thinking of going for a grant and I'm confident I will have gotten it. You could do better, that's possible. But I think I would practically say you need to think through the fact that you have a couple rounds of resubmission as a possibility in your future. So I would typically say about 2 years. The small business grants are a little faster paced than the research grants, but I think still when you take into account the ups and downs and everything else, from beginning of the thought of planning to actually seeing it awarded, that, and then like I said, with the grants, you then have to also just make sure that you're ready to receive the grants, and you have the infrastructure that can slow you down as well if you haven't.
Yeah, so I always engage. I have someone that I work with that helps a little bit with the grant writing. She crosses T's, dots I's, make sure the story is perfect after all the science is written. And then another consultant who helps companies submit the grants, because literally you don't want to submit a grant. Absolutely not. I would not recommend. I tried it one time. Dumbest idea ever. It took me months to figure it out. So absolutely. And I also think that you should be ready to spend money. So I know that in smaller companies, you're just getting your feet off the ground. It's hard to invest money in something that might not come through for 3 years, if it ever comes through, right? There's of course people who never get funded, but you should be ready to invest. You should have some money for that, because it costs money to have just those 2 people I mentioned. But if you want to submit something in 6 months, that's a pretty fast timeline, and you can do it. You're not going to see the funds for a while, but you just got to be willing to spend the money on getting it written how you need it to be written.
Anyone else have a perspective they want to share on managing that? Okay. Maybe there's another kind of more technical question around how should a new innovator think about IP rights when partnering with researchers?
I'll let you go first, and I'll
It's tricky. I mean, you have to look at it, and when you're thinking about IP rights, the question is, what did you each come into the equation with? And you have to work through that process, and you have to then look at the differing agendas, what the researcher's agenda is, the institution they belong to, how the institution is going to weigh in, and your own needs. Are you thinking that you need to own the IP because of venture capital or other things you're after? Or is it okay to have joint IP? But you need to think through ahead of time, and you need to know whoever you're working with, have they actually checked with their institution? Because you can have a number of wrenches thrown into the process. So from that perspective, if working with researchers, everything should be delineated up front and clearly specified in order to just make it go a lot smoother.
I second that, and just be ready that, universities want to make money too. And so they're going to claim IP in whatever capacity, and they're going to take, so if something comes out of that grant, they're going to get a percentage for the life of that product or whatever it is. Absolutely. You can negotiate. They're always going to go in high, and you can negotiate lower. You can definitely negotiate lower, but they're going to come in high, and so you definitely want to have it all situated prior. I'm actually working with a company right now. They had a university partner for their grant, and they hired me because the IP was such a mess and didn't really belong to the actual researcher. It really did belong to the business. And so they ended up, cutting them and then adding me to do that. And that was a whole thing in itself as well, with the NIH and the university and all those things. So you got to be super careful, do your homework up front.
So there's a question around actually venture capital for me on how do VCs look at these types of funding sources, and I can speak to that briefly. I would say it's not universal. Different people, different situations. There's not a one size fits all answer to this question. So it's a good one. I would say generally speaking, unless the company is one that is like completely scientifically oriented, let's say like a therapeutics company, a devices company, something like that, right? Like that's maybe like we'll put that example aside because often these can be like really core to those businesses and you're doing work that you otherwise would be doing. Putting those aside for a second, I think that's generally very positive. Putting that aside, if you're a company that doesn't otherwise like have to drive right through this door, there's always a little bit of skepticism that it might be a distraction or take you in directions that like you wouldn't otherwise be going in. But I think all else equal, it's a nice to have because ultimately that's, if you actually are doing research, let's say, and you're able to provide like a data set from this that then you can take to payers, you can take somewhere else, right? Like that's really nice that the venture capital doesn't have to pay for it. I mean, from our perspective, venture capital should be like the most expensive capital you're going to raise. And so if you can get like non-dilutive capital to do the same things that you would have wanted to do anyways, that's all the better. We're not going to see it as revenue or an ongoing funding stream. Like it's not going to be seen as a replacement for whatever other kind of scalable product market fit you need. But it's certainly nice to have, and we love seeing people who are finding creative ways to fund the business.
But you also, in your budget, like if you're going to do something, you pay your engineer, let's say, for a certain percentage of their time. That's cost savings to you. I mean, granted, they're doing something for the grant, but it's still cost savings. So if you have a science team and they're going to run the research at your company, it's like the grant pays for a percentage of that time. So it's still, I know it's not from the VC, but just in terms of your own pocketbook, it's cost savings if you could get one.
Absolutely. Maybe one other question around, so are there other, there's a question around, okay, so we talk a lot about, from federal funding perspective, NIH or NSF, SBIRs or STTRs, are there other funding sources that people should be aware of that they should be looking at that are non-dilutive?
I haven't heard PCORI mentioned. That's another federal funding mechanism, though you need ample amount of data to sit there. You typically, at least my understanding of PCORI has always been that you require data from multiple trials in order to really be competitive there. But PCORI mechanism can be, once you have the data needed, that can be very helpful. And then comes the varying foundations and so forth once you start stepping away from federal. But the only thing is when you're talking about SBIRs, it's not just NIH, there's also NSF, DOD, you have other agencies. ARPA, exactly. So there is a range. You need to find the fit, and so I think that is important to not just focus on one. And depending on the mechanisms, you also just need to make sure what you're doing is practically aligned.
Any others that? No?
I would just say state health and human service departments traditionally didn't do a lot of public-private partnerships. That has changed because of the need for innovation, for advancement in the care ecosystem. And you do have to get clear up front on who owns what, who's doing what can the state dollars or federal dollars be used for. For example, you can't use those dollars to lobby. But there are, I think of doing my doctoral degree, that public-private partnership, what's the brick of knowledge you're adding to the wall that can be democratized to make broad impacts? And state health departments have really changed how they're doing those funding partnerships. So I definitely encourage you to look at state health and human services.
Maybe dovetailing with that question, there's a question around sort of what trends do you all see happening in the federal and maybe even state funding landscape building on that and over the next few years? And, and how should organizations in this room prepare for those changes?
I think the biggest thing is kind of the stuff I already said is innovation. It's like the same, we see a lot of the same things. Digital mental health is a saturated market, so you got to come with something extra special, just because, that what we see is just like, some of them don't even make it to review. They get a little score before we actually go into review, and just because it's the same stuff. Like when I'm reading it, I'm like, oh, I already know like 2 companies that do this, So it's like, it's not really worth discussing because we're supposed to be bringing innovation, right? So I think that would be the biggest thing.
I would say towards the point about states, that's something that when you look at California, the Child Youth Behavioral Health Initiative is an excellent example of an investment that was made. And they have created a bit more of a space for app development and exploration and so forth without some of the commercial pressures, or I should say premature commercial pressures that could exist. And so I do think it's a hopeful trend that others will follow their example and try to find that balance between bringing things to the real world and also doing it in a more responsible fashion.
I think we also have an amazing opportunity to get out of our own way. And so if we just look at the number of payers, providers, early start, digital mental health, there's a plethora, and yet we have had 11 million people served via 988 in 2 years. So what do we need to do to streamline the ecosystem? And I know when you start a company, like you want your company to work, but are there other partners to be connected with? How do we take the noise out of the ecosystem and make it easier for people to get the care they need, want, and deserve in the modality, in the places, with cultural aspects that we need as a country? And so I'm trying to get out of my own way often and think, hey, are we the ones to do that, or is somebody else already doing that and we just partner?
Fantastic. So maybe just to wrap, we've got a great question, which is that, somebody observed, this sounds like a quite broken and inefficient process. Is there, that objectively seems to be the case. If you had a magic wand, just really briefly, a couple of sentences, like, what would you do to change it? You start on the end.
If I had a magic wand, I would it's what people always claimed in the research world, which was you'd probably put funding towards folks that you think you can get the job done, and at the same time do it not knowing the full plan up front. It's folks with a proven track record of success that if tasked with a vision, they will take it forward. So it's really about more rewarding the investigator or the investigative team rather than just the plan itself.
I would say streamlining the process and having some sort of consistency regarding expectations from everything from how the grant expectations or the funding expectations are communicated to the public, to what they're looking for regarding reporting and outcomes, and even having a consistent reporting system would be a miracle.
I think we could do a better job. There's a mechanism, it's like an R3361, I think it is. But it's like a go, no go is kind of the language around it. But we should be doing smaller grant, in my opinion, smaller grants and encouraging pivot. Try something out, doesn't work, pivot. Try something out, doesn't work, pivot. Which means that the team has to include the head of marketing, the salesperson, the product person, everybody needs to be on that grant, not just the data side and the CEO and the CMO and the CCO. Like, that's what goes on them. So it's cross-collaborative, keeping people out of their silos and encouraging pivots, because companies, if it's not working how they're supposed, it's like, oh, they're nervous, and the NIH grant says this and that, so we should be able to pivot. That's what your real life is in this. It's not working, I got to figure out something else. Or it is working, let's add that. We should pivot, and we should have grants for pivoting.
I have a friend who's a baker, I'll make this quick, and she makes unbelievable cake. And we were talking about it, and she said, you don't just start with a big wedding cake and then say, this is great. You start with really small cupcakes, and you taste it, and you say, does this taste good, or does this taste terrible? And then once you get that down, you make the next size, and then the next size, and then you make that big, big cake, and everybody loves it. We don't give people time, space, resources, energy to have a cupcake that tastes terrible. And we could do ourselves a whole host of good if we set up an environment where you can bake, you can have it not taste good, but you can course correct. And how we do that from payers, providers, research, nonprofits, communities, building that safe baking kitchen is really powerful. So let's not just make the big cake. Let's start and course correct on the small cake.
That's a fantastic place to leave it. More cupcakes, I think, is the answer here.
More cupcakes.
Well, please,
Life's about balance.
Please join me in thanking the panelists. This is fantastic. Thank you.